I'd like to start by focusing on the frontline management of patients with lower risk MDS, and then we will go into the second line management. So we know that anemia is the most important, cytopenia, the most important clinical problem that comes from MDS. Most patients are anemic. Most patients will need blood transfusions. At one point, they become also transfusion dependent. For a long time, we only had ESAs to use, which are still not FDA labeled for MDS, but they are still the most commonly used treatment for patients with anemia and lower risk MDS. And as several of you have mentioned already, luspatercept has a recent frontline approval based on the COMMANDS trial. So maybe I'll start with you, David. Maybe you can go over the COMMANDS main results, and then we'll talk about how do you integrate that in your kind of day-to-day practice.
Yeah. So the COMMANDS data was initially presented at ASCO. Update was presented at EHA, right after the FDA approval. But this is basically in frontline ESA-naïve patients. Patients with EPO levels less than 500, they have to be transfusion-dependent patients. And it was a direct comparison between luspatercept and erythropoiesis-stimulating agents. Ultimately, the primary endpoint was 12-week transfusion independence. And what we saw was about 2 times difference between luspatercept and ESAs, EPO in this case, at about 60% transfusion independence at 12 weeks, versus in the updated EHA, it was about 35%. But not only the transfusion independence rate was almost twice, but I think the most important thing for patients is the duration of transfusion independence. So it was about a year longer in the luspatercept group than what we saw in the ESA group. And this difference, not only is just in what you would expect the ring sideroblast population, but we also saw it when we compared TP53, ASXL1 mutant, even the higher risk molecular subsets seemed to respond better to luspatercept than ESAs. So, I overall think it was a huge practice changer for the entire MDS community, where in the majority of patients, we now use luspatercept in the front line.
Yeah, so you're absolutely right. Like the COMMANDS, I think, was one of the biggest news in 2023.